Knowing the normal blood flow of the heart is an important thing to know, whether you're an EMT or a paramedic. It is truly one of the foundations of cardiology. And knowing the normal blood flow will help us understand conditions that affect our heart and affect our lungs. So we know how to understand those conditions, what to look for in those conditions, and how to treat those conditions, not only for scenarios and tests, but for real patients. Hi, I'm Kenny with Code Ready Education, and in this video we're going to be talking about the normal blood flow of the heart to really build our foundation in cardiology so that you can go and learn more advanced items. Let's talk about the anatomy of the heart and the normal blood flow of the heart. So on here you can see I already labeled the right and left side of the patient. I'm going to draw an actual heart. And we're going to split that heart into fours. Now why I just did that is because we have 4 chambers of the heart, and that's important to visualize and understand. On the patient's right side, we have the right atrium of the heart. We have the right ventricle. On the other side, left atrium and left ventricle. Our atriums, which are on top here, they are the first to pump, and they pump blood to the ventricles. So these go down into the ventricles, okay? Now our ventricles down here, they are the second to pump during a cycle of pumping during a heart. Okay, so they're the second to pump. Some other important things to know is they are bigger than the atriums, and they're stronger than the atriums. They have more muscle than the atriums. Now, when we look at the heart, the right side here, your right side is going to have deoxygenated blood, okay? And the left side is going to carry oxygenated blood. Some more important things to know. Talking more about the anatomy, I'm going to draw a couple tubes here. Obviously, not going to be anatomically perfect. What we have here is our superior vena cava and our inferior vena cava. Okay? This is how blood comes back from the body into your heart. This is where blood travels to your heart. And this dumps into your right atrium. Now, from your right atrium, the whole job of the right atrium is not only to pump to the right ventricle, but to hold some blood too. And when we pump, I'm going to make a little hole here, we have our first heart valve. What these valves are simply doors. They hold blood back when it's not supposed to move, and they open when it is supposed to move. And this is our tricuspid valve. This is the valve that holds blood back in the right atrium and then opens to the right ventricle. Now, our next transition is to the right ventricle. And the job of the right ventricle is to pump blood to the lungs to get oxygenated. Now we have another tube here and another opening. Again, we need to hold the blood back. This is our pulmonic valve. Again, the whole job of the pulmonic valve is to hold blood back when it's not supposed to go into the lungs. And this is our pulmonic artery. There's deoxygenated blood going through an artery. Is an artery supposed to have oxygenated blood? Yes, minus the pulmonic artery. The pulmonic artery is the only artery that has deoxygenated blood leaving the heart. Now, a simple way that I found to remember arteries versus veins, let's look at the first letter. Arteries are always going away from the heart. And veins are going to the heart. Now if we look at arteries and a way, what do they have in common? We have an A here, I already highlighted that, and an A here. The simplest way I found to remember that is arteries away, A. Next, we obviously have our lungs, and I am going to put the lungs over here, and I am just going to label them like that. We're at the lungs, we're coming back to the left atrium. We have into the left atrium pulmonic veins. Our pulmonic veins are bringing blood back to the heart. And this blood is going to be oxygenated. We are now in the left atrium. And from the left atrium, we need to get to the left ventricle. Well, how we do that, you guessed it, another valve. And this valve is your mitral valve. From our left ventricle, again, we're going to build another tube here, and we're going to put some more valves. This is your aortic valve. And you can guess where the aortic valve opens up into. And if you guessed aorta, you would be absolutely correct. So I cleaned it up a little bit now that we understand the anatomy and have that drawing down. We're going to start from blood over here, which is coming from the body, okay? So the red line is going to be our blood. So our blood is going to come in through our inferior and superior vena cava, and we're going to go into the right atrium. At which point our heart is going to pump. So we go lub-dub, lub-dub. The lub is going to be our atriums pumping, and the dub is going to be our ventricles pumping. So blood comes into here, we fill up our right atrium with blood, and once we hit the lub, that is our atriums pumping, and that is going to pump into our left ventricle. Now we get a little break. We have to allow our ventricles to fill up. So our ventricles fill up, and then our dub hits, and that blood is going to leave our ventricle, right ventricle, via the pulmonary. That blood is going to leave the right ventricle via the pulmonic artery. And that's going to go to our lungs, and now we're oxygenated. So now our oxygenated blood is going to be blue. So respiration's occurred, we got oxygenation, and now it's coming back into the heart. And this is all occurring when we have heart pumping. So our dub, or ventricles pumping blood, is actually going to push this blood back into the heart itself. So once we do that, it goes into the left atrium. Again, need some time to fill up the left atrium with blood. And once our heart pumps, our atriums are going to pump, it's going to go through the mitral valve into the left ventricle. Again, we need some time, fill up our left ventricle. If one of these chambers does not fill up with blood, now we're just pumping air. If you think of it like a water pump, if you are pumping a water pump with air only, it's going to break that pump. And that is the same thing with the heart. So now our left ventricle is full of blood. Our heart realizes that. It is going to dub, or ventricle push, and we're going through the aortic valve into the aorta, out to the body. And that's where we're going to oxygenate and travel our blood into and get around the body. Our strongest chamber and biggest muscular chamber is going to be our left ventricle. So this is going to be our strongest chamber out of the four, because this has to pump all the blood to the body, all over the body. So this doesn't just push it to the lungs like the right ventricle, it's pushing it throughout the entire body. So it has to have a lot of strength and a lot of pressure behind it. Now our next strongest is going to be our right ventricle, because our ventricles, remember I said, are the strongest chambers.